Hello everyone, this is Dr. Mary Van. I am the Clinical Director at ThriveX Medical, where our primary focus is prevention, wellness, and we are IV experts. Today I wanted to go over the new COVID-19 antibody testing. This video is intended for both healthcare professionals as well as for patients. For all patients, we do encourage you to contact your local healthcare professional for guidance, but you are more than welcome to watch this video so that we all together can get a better understanding of the new antibody testing that are coming out. Now, this video is not going to describe the RT-PCR, the reverse transcriptase polymerase chain reaction that is done by nasal swab. That particular test is actually intended to diagnose whether or not the patient is actively infected with COVID-19, and that's not the intention of this video. Instead, we wanted to go over the different types of antibody testings that are coming out to the market, and there's a lot coming out to the market with varying levels of what's called specificity, which of course will help determine its accuracy. And I just wanted to go over the two most common types that we're doing here in the office, and not only to describe what the results mean, but also to describe how this affects you. This is a rapid diagnostic test done via lateral flow. Think of it like a pregnancy test meets blood glucose monitor. And the second one is a traditional chem-luminescent immunoassay, which is traditionally considered the gold standard. And I should probably mention that the majority of tests are not FDA validated. Rather, they are being permitted by the FDA to be utilized via the emergency use authorization. All clinicians need to make sure that when they get these types of test kits or labs into their office, that they are asking for CEs to determine what the specificity is, so they make sure they're getting some accurate results. So you know what we're testing for. We are actually testing for antibodies, which means that the innate immune system, the first line of defense, has actually failed, and now the adaptive immune system has to kick in. And what the adaptive immune system tries to do is, number one, it tries to go in there and record who the viral invaders are, and that's what IgM is. IgM is what we call short-term memory. Short-term memory appears about 3 days into the infection and lasts for several days. IgG is the second type of antibody we're testing for, and that's long-term memory. IgG occurs in about 7 to 10 days and will normally stay for the patient for the rest of their lives. This doesn't imply lifetime immunity though, because antibody levels can drop to a point where the patient can get reinfected. So let's see what these results possibilities are. Again, here's IgM and IgG, short-term and long-term memory. I'm negative, which means not that I haven't been exposed, but that my own immune system was strong enough to fight off the virus, or whoever was infected wasn't close enough to me for me to contract the virus. The second possibility is IgM positive, IgG negative, which means that the person would be in the early phases of infection, about 5 or so days into it. IgM positive indicates that the long-term memory is kicking in, so that's about 7 days in. So the patient's more toward the latter phase or the end of infection. IgM negative and IgG positive indicates that the time has passed enough for the short-term memory to dissipate, and the IgG will stay for the patient again for the rest of their lives. And this indicates that it's been more than 2 weeks since the patient was infected. Again, this does not imply lifetime immunity. That has yet to be determined because we lack good quantitative labs to tell us how much antibodies we have. Hopefully by May or June, those testing will be available. But these tests are utilized to indicate post-infection. The tests are qualitative, not quantitative. Right now, the technology isn't at a point where we have widespread quantitative data. The difference, of course, is yes or no, but also quantitative data gives us an idea about the level of immunity you have. Qualitative doesn't give you that information. It's just telling you whether or not the innate immune system has been overcome, and if your body has learned to recognize the virus. Instead, what we're looking for, hopefully in May or June, is quantitative data. At this time, we don't know what the antibody levels are necessary to build immunity, and even how long that immunity will be in effect. If we are to follow SARS models that occurred several years ago, immunity did waver after about 2 years. So even though you will have these immunoglobulins, these IgG, for the rest of your life, just because you have the presence of them doesn't necessarily imply that you're immune, which is one of the reasons why we're doing these tests. Number one, we want to check to make sure if we have had any exposure, but also when we do these testings, one of the things we do as part of our education with our patients, because we do believe that patient education is extremely important, is for them to understand that these immunoglobulin testings are indicating that the primary innate immune system, which is that first layer of defense, has failed. In our office, we are not surprised at all that none of our patients thus far have tested positive. None of our employees have tested positive, which makes complete sense to us because we strive for prevention. We don't want to be reactive. We want to be proactive. All of our patients, all of our employees receive regular infusions of vitamins. We make sure we test very regularly to make sure that our metabolic levels of nutrients are at the highest possible levels that we can reach, because we want to make sure that innate immune system is strong enough to fight off the virus and give us that layer of protection. For those patients who have had exposure, one of the things we're trying to do, and the patients who test positive for the antibodies, we're trying to rebuild that immune system. We're trying to rebuild those walls, and at the same time, we're trying to regulate the adaptive immune system so that it doesn't overreach itself, which is what we see, unfortunately, in our patients with acute respiratory distress syndrome. Is not that the adaptive immune system is weak, but that it has overreached itself and actually is doing more harm to the body. And that's one of the primary things we look at after we look at building the immune system. We try to then regulate the immune system so that it's neither too high nor too low. I hope this video helps you all have a much better understanding of what these antibody testings are, what they can do, what they can't do, and of course we do encourage everyone, no matter what the results are, whether you be positive or negative, to comply with all CDC, federal, state, county, and city regulations so that we all stay safe. Thank you very much, everyone.